So we're going to talk about whole brain treatment. Normally, the patient will have a mask. Normally, it'll be a three-point setup. You're going to use your side lasers to line the patient up on the left and right lateral. You'll get 100% on with your laser on the side of the mask. I'm going to walk to the other side of the table. So once you have your patient lined up, you'll then, well actually there's two ways to do it. You can line your patient up like this and then rotate the gantry over to the side, or you can start off on a lateral using the crosshairs from the collimator and the opposite laser. Any way you get it lined up, it's fine, depending on what your facility likes to do. You will usually, if you've got a good simulator person, have an anterior mark as well. That anterior mark is going to give you your left-right positioning. When the person is set up in 3 points, usually this is going to be just a left and right lateral whole brain treatment, which means it's going to be mid-plane. So you're going to have equal or almost equal SSDs from both laterals. Okay, so you'll be equal distance from the right lateral and the left lateral. So I'm going to rotate the gantry over to the right lateral since you are on the patient's left. Once you're in place, the treatment will take place from each lateral, as I said. We discussed in class the fact that you have specific borders that you have to be mindful of. I'm going to set a field. I don't actually have a patient called up that corresponds with this particular mask. But I'm going to set what is essentially a whole brain treatment. Your normal borders for a whole brain are going to be from outer canthus to the mastoid tip or tragal notch, okay? You're basically going to be blocking, I'm doing this backwards so it's difficult, I'm sorry. Let me turn the collimator so that it actually reflects what I'm talking about. Your blocking will take place from outer canthus to mastoid tip. You're going to be basically blocking the face and the eyes. Your normal, the field size that you'll normally start with, hey, I guessed and that was almost there. 22 by 17 is a typical starting field size for most human beings' whole brains. Once you get into dosimetry, you'll see that a dosimetrist typically will just start with that field size. It fits most people's heads. Some of us have larger heads than others for different reasons. But a normal field size of 22 by 17 should typically encompass a person's whole brain. So, again, borders. Your inferior field will kind of be angled like this, or it'll be square with a block to block the eyes, facial area, just so you're treating only the brain case. Okay, so your field size, your inferior field will extend from outer canthus to either mastoid tip or EAM. All of your other borders will be flash. What is flash? Flash is when the radiation field itself goes around an object out into space without being blocked or absorbed by either the patient or a block. So flash means that you actually have the field size larger in this particular case than the rest of the head. So all of your other borders will be 1 to 2 centimeters of flash. For instance, your inferior border from outer canthus of the eye to the mastoid tip. Anterior border, 1 to 2 centimeters of flash. Superior border, 1 to 2 centimeters of flash. Posterior border, 1 to 2 centimeters of flash. There will be radiation going around the patient out into space, anterior, superiorly, and posteriorly. That will be on your quiz. Somebody misses it every year. I get mad every year. We've already gone over this, and I want you to know that this is going to be on the test. I'm going to ask it just like this. What are the borders for a whole brain treatment? And you're going to say the inferior border is outer canthus to mastoid tip, superior border is flash, Anterior border is flash and posterior border is flash. 1 to 2 centimeters is about what you normally see. That's the basics of a whole brain. They're the easiest thing to set up. Okay? So what you do need to know, I'm going to come back over there. Your typical headrest, if you're using the Timo Silverman headrest, is going to be a B headrest or an F headrest. These are basically exactly the same headrest. They're the same shape. The B just happens to be a little taller in order to accommodate someone who can't get their head back as far as a typical person would. You'll see these used about half and half. Normally, I see a B headrest as your most common. It puts the patient in a neutral position. Once again, the neck will fit into the curve. The skull base will fit into this part, kind of the cup or the bowl. And then the patient will go on top of like this. They will end up kind of in a clamshell position and thus being held in position properly. Most places are going to use, say, a table pad to keep the patient comfortable. If you do use a table pad, make sure, and once again, I apologize for those of you not using Varian equipment. It's going to be a variation on the same thing. But on a Varian machine, if you have the table extender, as I have, you can see that there's kind of a delineation right here. Don't let your table pad go past there. If you have a table pad in place for your patient's comfort, that's great. But you want to keep it back far enough that you don't affect reproducibility here. So if you have the patients, basically kind of the tops of their shoulder blades will fit on the hard part of the table. That may not be as comfortable, but that's fine. We're looking to have reproducibility, not comfort. If you have the table pad further up toward the patient's neck, that's going to affect how this mask fits. For instance, if it's simulated with the table pad down in the proper position, and then you decide, hey, I want to make the patient more comfortable, and I put the table pad up here, it actually changes the angle that they lay on the table, thus the mask won't fit correctly. Let's say tomorrow, you decide, I want to get the table pad up a little bit further. Then it's really not going to fit. Then the neck is not actually going to fit down into the headrest like the neck is supposed to. So be consistent with everything that you do on a daily basis, including where all of your accessories and mobilization devices go on the table when you treat them. So I use this line as a delineating factor. There's also an overlay that you can use with that comes from Civco. It's actually got a line painted on it. That line is for the table pad to stop, and it corresponds with the same position. So make sure that your table pad is not too far up on the table and thus interfere with your setup. When we get to head and neck, we'll talk about this again, but we typically don't necessarily use the table pad for head and neck because the masks are longer and it can interfere with the fit of the mask in the chest even more. In some cases, you can have, say, a table pad under their hips, but not up here under their chest. That's for another lecture at another time. That seems to be about it. So